my name is Alisa Studley. I'm a physician assistant with Women's Health Specialist of Advantia. Always welcome to talk to people and have people come in and accepting new patients. I just want to let you know that we're going to discuss IUDs today. IUDs are birth control devices that go inside the uterus. Now, these could be a couple of them. There is a Skyla, which secretes progesterone, and it's only good for 3 years. There is a Kalina, which is good for 5 years, also secretes progesterone. And we use those for people generally who have not had children before. And then there is the Marina, which is good, also secretes progesterone, and it's good for 8 years. The Liletta is also good for 8 years. And then there's the Paragard. It's the non-hormonal birth control, and it's good for 10 years. That one may make your periods a little heavier and crampier. Now, IUDs have progesterone. There's very little absorption into your general system. There's always possibility of complications of perforating the uterus, infection in the uterus, implantation in the uterus, needing surgical removal, or spontaneous expulsion where it comes out on its own. Progesterone works by thickening the cervical mucus and thinning out the cervical lining. And the Paragard, which is a copper IUD, works by getting in a bad environment and decapitating the sperm. So when you put an IUD in, you have the vagina here, you put a speculum in, and that opens up the vagina so you can see what's going on. You wash off the cervix with some soap. You then put some numbing stuff on it. You put something called a tenaculum. It's something so the uterus doesn't move back and forth, because if you're putting something in, you want to make sure it's inside the uterus and you know what it's doing. Then we open up the cervix a little bit with something called it's a Q-tip, which we put some hurricane on it or numbing stuff. And everybody has their own little different ways of doing this. It's the way I personally do it. And then you put a measuring stick in called a sound to see how big the uterus is. So when we put the IUD in, it's got a little measuring device here that we can put to the right length so we know we don't go through the uterus. So this is a Kalina IUD, and it's made for this model. We close this up after we know how big it is. We put it in through the cervix, and anything going through the cervix does hurt, but if you take some Motrin ahead of time and maybe use a heating pad during the procedure, it helps. So we put it in, we open it up, push it out, and then cut the strings. The strings are in the vagina. They're not hanging out like a tampon string. And then if you need to remove it, not yourself, but in the office, we can pull the strings and take it out. It does hurt to use an IUD, put an IUD in, but in general, it's good for many years, and sometimes pain can be there, but it's not that bad. It's doable, and most people are very happy they have it. This is a copper IUD. As you can see, Paragard, it's got the copper coils around it. This is put in a little differently than the other ones, but very much the same as well. So it just comes down, and we put this in and then push it through. So that is pretty much the birth control, the IUDs, and the options for the IUDs. And like I said, it's a great option. You don't have to remember it for anywhere from 5 to 10 years, depending on which one you choose. And most people are very happy with them. Give us a call if you'd like one.